As many people as possible should be trained in CPR and be prepared and confident to act in an emergency where there's an unresponsive, non-breathing adult, child or infant. Any attempt at resuscitation is better than none. Effective CPR can greatly improve the chance of a positive outcome for the patient. The steps in this video will teach you everything you need to know to carry out CPR yourself and will give you the confidence to do so. This video is for the layperson and not healthcare providers. If the person is unresponsive, try to rouse them by tapping them on the shoulder and calling their name if you know it. If there is no response, check for breathing for up to 10 seconds. If there is no breathing or only gasps coming from the patient, direct someone to call 999. Begin the steps of CPR immediately and do not check for a pulse. Give 30 compressions. It's important to remember that you must push hard, push fast and allow full chest recoil. A head tilt, chin lift is used to open the airway. You open the mouth by gently pressing on the patient's forehead with one hand, and you place 2 fingers from the other hand just under the edge of the lower jaw and lift the chin gently. Ensure that your fingers are in the bony part of the jaw so as not to block the airway. Then give 2 effective breaths, pinch the nose shut to prevent the rescue breath from escaping, and place your mouth over the patient's mouth and breathe. Continue cycles of 30 chest compressions to 2 rescue breaths until the patient starts breathing normally and/or the ambulance crew arrive to take over from you. Try not to have interruptions in chest compressions of longer than 10 seconds at a time. Important points to remember. Adults and children must be on a firm surface for the compressions to be effective. Ensure your hands are between the nipples and on the chest bone or sternum. Minimise the number of interruptions. When compression stops, oxygen delivery to the body stops. Give no more than 10 seconds for rescue breaths. Push hard. You should be pushing at least 1/3 of the depth of the chest in an adult and child. Push fast. The rate should be at least 100 beats per minute. Allow complete chest recoil by lifting your hands slightly off the chest to allow the heart to completely refill. Don't lift off too far, as you'll create a bouncing action which can break the ribs. And do not overventilate. The important part is getting oxygen to the tissues, not how much is in the lungs or blood. It is also important not to ventilate too hard, as often some of the air will end up in the stomach. CPR does save lives, and it's important that people are confident to do it. This video has hopefully taught you these skills and given you the confidence to use them should they ever be required. Please share this video far and wide and help others know how to save a life. For more information on any of our courses, please contact BridgeCare